Good afternoon and welcome to our St. Vincent Martin House. My name is Jonathan Nally and I'm the Chief Executive Officer of St. Vincent, and I'm just pleased that y'all are here to join us today. It was a year ago that we stood here and came together as our Governor Pence announced Healthy Indiana Plan, HIP 2.0, to our state and the entire nation. And it's been an incredible 12 months and years since. At St. Vincent, we're a member of Ascension, the nation's largest nonprofit healthcare system, and we share your values related to healthcare that is compassionate, it's personalized, and we leave no one behind. And I'm proud that our 20 St. Vincent hospitals throughout the state of Indiana have enrolled more than 12,000 Hoosiers into our HIP 2.0 program. And thank you. And it gets even better. Together with the state, the other Indiana hospitals throughout the state, and our community health workers, together we have enrolled more than 370,000 Hoosiers that now have access to the care that they need. If you would view the monitors, I'd like to take a minute, share a video so we can see some of these Hoosiers who now have this positive, incredible impact of HIP 2.0.
Today, after 7 months of active negotiations with the federal government, I'm pleased to inform you that effective February 1, the Healthy Indiana Plan will be available to more Hoosiers than ever before. The state of Indiana has reached an agreement with the federal government on our Medicaid waiver. The Healthy Indiana Plan 2.0 has been approved.
It's a game changer. It's a life-changing possibility to upgrade a little bit more every month to get the care that we need. I just never heard anything like that. I can't believe it's available.
Yeah, to be healthy, to have these people allowed to have insurance and go to a doctor and take care of small things when they're small. As long as you help them stay healthy and catch things when they're just beginning, just catch a little problem, it can be fixed so easily instead of long drawn out recuperative situations.
These are not people that were laying back trying to take from the state. These are people that are trying to get a step ahead, and often it's healthcare that held them back.
And frankly, the way the governor set up HIP with a lot of preventive aspects to it really encourages people not just to have skin in the game by paying some money to be in, but also encourages them to look at a new way of dealing with their health care, getting preventative care, early intervention, which has been so important both on the mental health side and the physical health side too.
Speaking for what I know about rural folks, there was such a need, more access to care, prevention and wellness opportunities. I think the whole industry and individuals themselves are really figuring out the best way to lower cost in healthcare. You hear about that all the time. Is take more personal responsibility for your healthcare. And HIP 2.0 gives that most vulnerable population an opportunity now to do that.
When you do something that benefits you and makes you feel better, you do want to share it. You want other people to know that this is available and nobody has to go without being able to go to their doctor when they feel something's not right.
What we know about behavioral economics is that incentives do push people to make better choices. We do that in finance, we do that in health, we do that in education.
HIP 2.0 is hardly a tough sell. People see right away that it's an insurance program that was designed for them, and they're eager to enroll. They don't mind the skin in the game aspect of the program. We don't get complaints about that. People are able to pay those small amounts.
In some of the most rural areas that we serve, in some of the poorest urban areas that we serve, I've not heard the barrier being, the power account contribution.
I'm not surprised at all by the high percentage that are paying their way and staying on the higher level plan. The amounts are relatively minor, but they're significant in terms of, the person having the pride and the dignity to go in and make that payment every month.
I had not had new glasses in 12 years. I do now because of the little premium that I'm allowed to pay. To be able to see is so important. Without it, you can't read, you can't write, you can't do art, you can't even wash your dishes right.
Well, I think what's so excited by the efforts of the state and how that has played out in the lives of my neighbors is the idea that they have choice. They can choose what direction they want to take in their health care. It's empowering to those in poverty to be able to say, I can choose what's best for me and for my family, for my kids, and for my spouse.
One of the great things about HIP 2.0 is that if we can actually say and demonstrate that minorities benefited from this, that's a very, very good thing for the state and the nation.
Right.
Because in minority health, you need models to illustrate what can be done.
We know for a fact that the earlier you are able to catch somebody with a mental health or substance abuse condition, the earlier they receive treatment. That's the key, early intervention and prevention. And the fact that HIP 2.0 focuses on that is exactly what we need in the behavioral health realm.
It's excellent. But the thing is, you feel good. You feel good again. And I think everybody wants to do that.
If anybody hears this that can get something out of it, do it, because the benefits are incredible. The program's amazing. Usually when you tell somebody about something that's really good and it works, it's amazing how many friends you can make. And it's true.
Absolutely incredible. Since taking office, our governor has been committed to expanding health care the Indiana way, which means we're basing it on personal responsibility and allowing Hoosiers the empowerment to take care of those health care choices. States across the nation have taken notice, and they look to Indiana as that example. Beyond HIP 2.0, the governor is also working hard on how we tackle other pressing issues, drug abuse and addiction issues. And with that, his administration has recently announced the construction of the state's first mental health hospital in more than a generation. Absolutely wonderful. Governor, your commitment to health care for Hoosiers has been evident since the day you took office. And with that, we are grateful for your unwavering leadership. Governor Pence.
Thank you, Jonathan, and thank you all for your kindness and your encouragement and your engagement and your partnership in the last year. It is extraordinary for me to think in 12 short months, with your collaboration and with the full participation of all the outstanding healthcare providers gathered in this room, we have touched the lives of 370,000 Hoosiers for their good and for the benefit of all of the people of Indiana. So I thank you. Thank you for one successful year of HIP 2.0. We're here to mark a milestone of accomplishment and collaboration and partnership, but we're also here really to tell a story in the hopes that that story will be more widely told. And in the few moments that I have, I want to celebrate what we've been able to do together with the people of Indiana have been able to do together. But also to say that we have work to do in continuing to make this program available to Hoosiers at the point of the need. I'm very honored to be joined by so many that made such an enormous difference in helping both to craft this program, but also to implement this program so successfully over the last year. In terms of the crafting of the program, I'll have more to say about her later, but there's probably, I told her there's only one decision she's ever made that I disagreed with. Her decision to retire. Senator Pat Miller, for all of Jonathan's kindness to me in that introduction, it's actually doubly true for the leading advocate of health policy and the Healthy Indiana Plan in the state of Indiana. Senator Miller, it's good to have you here. Thank you for your leadership. Proud of the members of our team who are here, in particular Dr. John Werner, our Secretary of FSSA, who I think you got a seat somewhere. John, give us a wave. Appreciate it. Got a good seat. John's done a terrific job and lived up to the promise of me being able to appoint the first doctor to lead the Family and Social Services Administration. And John, we appreciate your leadership. Also, Dr. Adams, our state health commissioner, is here, has played a tremendous role in helping us reach out all across the state of Indiana with this program, and of course to all of the other dignitaries on the stage and members of our cabinet. I note in particular we were together this morning at a local elementary school, our superintendent Doug Carter with the Indiana State Police. Give all these folks a round of applause if you would. They sure deserve it. On this program, if you'll permit me, there were a number of key members of our team that played a key role in both the negotiation for this policy as well as its implementation. No one was more responsible for the successful implementation of the Healthy Indiana Plan 2.0 than our former Deputy Secretary of FSSA, Michael Gargano. He worked with staff, with vendors, with health plans, and did a remarkable job. And stand up and just give him a round of applause. He did a wonderful job rolling this thing out. Thank you, Mike. Very, very big job, very complex. And I know Dr. Werner would be the first to say how grateful we are that you brought your extraordinary experience to bear on this project. Secondly, I want to acknowledge two other members of my close-in team. One of whom has flown back from Washington, D.C. He now serves as the Chief of Staff for the Senate Policy Committee, works closely with Senator Dan Coates. But I can tell you that throughout 18 months of tough negotiations, I didn't have a single senior staffer who spent more hours, or more importantly, poured more heart into seeing us be able to expand the Healthy Indiana Plan, the Indiana Way, than Brian Neal. Brian, stand up, take a bow, will you? Good to see you. Welcome home. And lastly is Seema Verma, is president and founder of Seema Verma Consulting. She's worked extensively in state, local, and federal government health agencies, worked in the prior administration, worked very closely with us hand in glove as we rolled our sleeves up to find a way to expand this program in a way that would be in the best interest of Hoosiers. She served as health policy advisor for Governor Mitch Daniels, and from the standpoint of senior staff, there was no individual, I think Brian would concede this point, no individual who helped us guide this more effectively or with more integrity than Seema Verma. And so before I get into some very brief formal remarks, I wonder if you might join me in congratulating the latest recipient of the Sagamore of the Wabash for all she has done for so many Hoosiers in the Healthy Indiana Plan. Seema Verma, come on. For a second. She said, "Don't make me say anything." All these leaders were dedicated to improving and extending health care the Indiana way. And together we did it with all the partners that are in this room. And I'm truly humbled and truly grateful to have been a part of that. And it's accurate to say Indiana is leading the way in Medicaid reform in this country. Headlines today in another state have local officials actually putting forward the Indiana plan for Medicaid. States like Ohio, Kentucky, and Michigan are already pursuing programs modeled after ours, and well, they should. With HIP 2.0, we've ended what I truly believe was a program that's not only broke, but broken, and replaced traditional Medicaid for all non-disabled adults with a consumer-driven healthcare model that prepares people to move off of public assistance. We got a number of courageous Hoosiers who stepped forward and took greater control of their own healthcare future. New HIP 2.0 enrollees who are here, we're grateful that you're here. And grateful, Brad, for you and the others that took time to be on that video to tell your story. I said to each one of them in the back room a few minutes ago, when my late father used to quote one proverb more than anyone else, which was, "To whom much is given, much will be required." And that we talked about how the people of Indiana had extended this opportunity to them in the hopes that they would seize it, as they all are, to improve their health and improve their lives. And I'm grateful for their presence here today. And that really is what we're all about with HIP 2.0. Not only improving health outcomes, but improving lives and improving the fortunes of Hoosiers. And I couldn't be more grateful. It's been with the help of so many of you that we built this innovative and fiscally responsible program, which would not have been possible without the Indiana Hospital Association. And I don't want to come to this anniversary date without acknowledging the extraordinary work of the Indiana Hospital Association, and also specifically Doug Leonard. We are so grateful that our health provider community became a full partner with the people of Indiana to improve the health of Hoosiers. And Doug, we thank you, and all your constituent members here. Since announcing a year ago the approval of the waiver, as has been mentioned by Jonathan already, 370,000 Hoosiers have enrolled in the program. Since HIP began, 70% of enrolled individuals have now elected to make contributions to a power account. That's 70% more than some people in Washington told me it'd be. Of this group, 83% are earning below the poverty level, and some making their $1 a month contribution, but they're making those contributions, which is incredibly exciting to me. Our data tells us 94% of Hoosiers that are enrolled in the HIP Plus program are making those contributions on a regular basis, on a timely basis. Nearly 1/3 of HIP members report asking their doctor about the cost of health care, affirming the value of consumer-driven health care, and enlivening the consumer sensibilities of people once they're put in control of their health care choices. 52% of HIP members check the balance of their power account. Just over 1/3 check the balance at least once a month. There is something to be said for the dignity of empowering low-income Hoosiers to make their own decisions about their own health care. People stand a little bit taller, and that is probably beyond all the policy issues, beyond all the larger numbers and the impacts, that's what blesses my heart the most. And I know it does yours as well. When it comes to individuals, I'm pleased that people, when they moved into HIP, emergency room usage is also lower by an average of 42%, and the statistics continue to be encouraging in this program. Probably most encouraging to me is the partnership that's been reflected here. There's that old adage that says, give a man a fish and he'll eat for a day, teach a man to fish and he'll eat for a lifetime. And the truth is that the Healthy Indiana plan gives people the tools and empowers them to be able to make health care choices, which I think empowers everybody, every aspect of a person's life as well. We launched a job referral and training program, the Gateway to Work, for participants of HIP, and the HIP Link program for premium assistance for employers. I'm pleased to say that 3,200 HIP participants in the first year alone have used our job search and training programs with success. Member satisfaction is also very high. We've heard stories about how Hoosiers are seeing the benefits of our program. 86% of HIP Plus members said they were satisfied with the program or very satisfied. 94% said they'd re-enroll. 83% said they would pay more to be in the same program. But probably, I think, most reflective of this program and most responsible for its success has been the collaboration with our healthcare provider community. And there's so many CEOs of so many of Indiana's leading hospitals that are here today. I just wanted to express my thanks. I mean, the truth of the matter is, one of the ways that Medicaid was broken is that even if a person had a Medicaid card in their purse or in their wallet, fewer and fewer healthcare providers were taking Medicaid patients. So it isn't that we gave people a card. The Healthy Indiana plan, through its innovative financing program and its reimbursement rate, actually give people a place to go. And that, to me, is what's most exciting. In the last year, get this, in the last year we've added over 5,300 new healthcare providers that serve Medicaid and HIP members. That's extraordinary. We're working right now on a streamlined process to actually expand that list and make it easier for providers to participate in the credentialing process. And but that is really, that's a statement about our healthcare providers in the state of Indiana and their compassion and their concern that they've opened the doors of opportunity. 55% of provider surveys indicate they've seen a decline in the number of people without insurance, and almost 40% have seen a decline in the requests for charity care. So there's been extraordinary reforms. But I leave you just simply with one word of request, if not admonition, and that is, for all that we've been able to accomplish together over the last 12 months, there's more work to be done. The truth is that our efforts, we transferred roughly 100,000 people into the Healthy Indiana plan. We essentially ended Medicaid for able-bodied adults and moved people in that category into HIP 2.0. We've now managed to get the word out successfully to about 270,000 more people. That's where you get the 370,000 number. But our number still is about 550,000 Hoosiers are eligible for this program. That means there's several 100,000 Hoosiers out there that may not yet have the word that you got about what's available in this program and the health benefits that are now affordable to them and to their families. And so my word to each one of you today is, as we gather today to say thanks and gather today to really celebrate what the people of Indiana have accomplished together, that is inspiring states around the country to think afresh about the principles of healthcare reform on the state level, healthcare reform that empowers individuals rather than empowering government. I want to encourage each one of you to leave here today, maybe pull your team together at your organization and say, all right, what are we going to do in the next 30 days to get the word out about HIP 2.0? I just left a luncheon meeting with county officials from all over the state of Indiana. And in addition to talking about what we're doing on drug abuse and addiction and treatment programs, I said to them, I really need your help. Because probably the people that we're not reaching yet are the people that are hard to reach. And we started this conversation when we first launched HIP 2.0. We knew that for many people that are struggling on the first rung of life's ladder, it's difficult to reach those individuals, and some people have fallen through the cracks as a result. But now, getting the word out directly, working with local stakeholders, not just in the healthcare provider community, but faith-based organizations, churches and synagogues and faith communities, to get the word out. That's our objective here in the next year. It's not about growing our enrollment numbers. That's really not what it's all about. It's just about making sure that everybody who would choose to be a part of the Healthy Indiana plan knows that it's available for them to do it. And so I ask for your help in that regard. So with that, we celebrate a year of accomplishment. Today, in fact, if you missed it, it's not pre-printed on your calendar, it's HIP 2.0 Day in Indiana. But I get to do that kind of stuff. Even have a plaque here. I'll give you Doug. I'll give you the whole plaque. But the other thing you do on a day like today is you also do say thanks. And I do think this is an appropriate day for us to establish one bit of recognition that we ought to do from time to time, and that is single out individuals who, through their contribution, through their character, through their creativity, have made a unique contribution to public health and in public service. And so we've established today, as a part of this annual commemoration, the Healthy Indiana Public Service Award, which will henceforth be bestowed on individuals whose commitment to furthering the goal of achieving a healthier Indiana has made an exceptional and extraordinary difference in the life of our state. And I honestly couldn't think of anyone more deserving, or anyone who will ever be more deserving of the first Healthy Indiana Public Service Award than Senator Pat Miller.
Well, they've given me an opportunity to talk, and talk I will. So first of all, I want to congratulate the governor. This is a first anniversary. It's not only the first anniversary of HIP, it's the first anniversary of a great accomplishment by Governor Pence, because without Governor Pence's tenacity, dealing with the federal government and the Secretary, the U.S. Secretary of Health, we would not have HIP. So, Governor, I just want to congratulate you and say this is also your anniversary. I don't have any award to give you, but I'll get one. So, and I also want to thank you for that award. I'm very honored and pleased to receive that award. And I'm, having announced I'm not running again, there are lots of times when I'm brought to tears, but I'm bound and determined not to cry till the very last day I walk out of the State House, but that's hard. That's hard. So I was told I could make a few comments, and you all know how old people are. I've looked around the room, and I'm sure I'm the oldest person here. And, old people talk about the good old days and when they were younger and all of that. And I remember thinking when my parents did that, when I get old, I'm not going to do that. Well, I'm old, and I'm going to do that. So, but I won't be long, but I do want to tell you, I've been in the General Assembly. This is my 34th year. And I want to go back to when Evan Bayh was governor. Chris Bailey was the Commissioner of Health, and he and I were talking. I was chairing health. And I said, I want us to buy health insurance for the working poor. And he said, you can't do that. You don't have enough information. So we did a study. We did a 3-year study, and Eleanor Kinney, I don't know how many of you know, she's an attorney. She chaired the committee. But one of the things we did in this study was go out and actually talk to the working poor to see what they wanted. And Governor, you talked about some of the things that they want to do. They have pride. They work in 2 jobs because they want to take care of their families. They don't want government to take care of them. They have pride in how they get health care, and they want to contribute to their health care and make health care decisions, and they want to help pay for their health care delivery. So of all the things we learned in that 3-year study, that's the one thing that has been so profound to me all of these years, is the involvement that these people wanted to have in their own health care. So $1 a month to me, Governor, is very important because it does give dignity to the families. It does give them ownership. It helps them use health care in the right way, not to go to emergency room, but to use their power account to go see their family doctor and use it in the right way. So we talk a lot about skin in the game. I think that's a very important part of this program, and I'm so glad that you held on to that, Governor, through all the negotiations that took place in HIP 2.0. But then I want to skip back to 2006, which in that year we put language in a bill. Mitch Daniels was governor. Mitch Robe was Secretary of Family and Social Services, and we put language in a bill that said the Secretary of Family and Social Services had to come with a plan to provide health care for the working poor. And I want to acknowledge Mitch Robe because he was tenacious in working through that. And after that summer, he came back with a plan that ultimately became HIP. But Mitch, thank you for your being willing to work through all of that. And I want to join the governor in thanking Seema Verna and Michael, and Doug, and Tim Kennedy was instrumental in that. And when we did the first HIP, we had literally hundreds and hundreds and hundreds of hours in negotiating the HIP plan with Mitch, Charlie Brown, Tim Kennedy, and myself, and others to come up with what we thought was a great plan for health care. And so now I'm going to fast forward. See, I'm not as old as you thought. So I want to talk a little bit about Governor Daniels and HIP 2.0. He's my hero in health care, and I hope you all agree with me, because he said no to the ACA. He said no to expanding Medicaid. Medicaid is a broken system. It doesn't work for consumers. It doesn't work for providers. We have millions and millions of dollars of fraud across this country in Medicaid. Oregon did a study that shows that people on Medicaid have no better health care outcomes and health care delivery than those who have no health insurance at all. That was not the way to go. So, Governor, I am so grateful to you for doing what's right. And I want to say this governor did what was right for the right reason. I'm so proud of you for doing that, Governor. And I guess I'll make a political speech, because what are you going to do to me? Yeah, you know, this governor is up for re-election this year, and he talked about his vision for the future in health care. And I think he deserves the right to continue the program that he started in health care. And if for no other reason, I hope that you will vote for Mike Pence because of his commitment to health care and health care. Really, when you think about your life, doesn't matter how rich you are, doesn't matter what all you have, if you don't have good health, you simply don't have a good quality of life. And so, Governor, I thank you for what you've done and what you're doing. And so, I could say a lot more, but we need to share and let other people talk. But I'm very sincere. Governor Mitch Daniels, he is a man of faith. He does what he believes in. What you see is what you get. And so, what's going on here? So anyway, thank you, Governor, very much. They look a lot alike, don't they? I'm so sorry. I was looking at Mitch, and that's the wrong Mitch. Anyway, I do mean Governor Pence. Governor Pence, Governor Pence, Governor Pence.
Thank you, Senator Miller. With that, I'd like to invite another individual to the podium, Dr. Satunde. We've heard a lot from our HIP 2.0 members and enrollees, but I believe it's most important to also hear how important this has been from our private health insurance companies. Dr. Satunde is the President North Region of the Medicaid Government Business Division of Anthem. And Anthem, MDWise, and MHS, they serve our HIP members throughout the state of Indiana. So I'd like to introduce Dr. Satunde to the podium.
Good afternoon. It's indeed a pleasure, honor, and privilege to be here today in celebration of the one-year anniversary of the Healthy Indiana Plan, otherwise known as the HIP 2.0 program. Let me start off by thanking Governor Pence and his team for taking the leadership to making this become a reality. None of this could have happened without that leadership. So congratulations, Governor. What a momentous occasion. As the president for the North Region in the Medicaid Business Unit at Anthem, I have direct responsibility for 5, soon to be 6 states that make up the North Region. And I also have a fair amount of knowledge and experience with the Medicaid programs across all 19 states where we are currently privileged to serve close to 6 million members across the country. And without a doubt, there is no other program, again, no other program like the HIP 2.0 program. one that is designed to drive member responsibility by providing individuals a stake in their healthcare purchasing decisions through the Power Account that individuals can make contributions into. And for those individuals that are unable to make contributions, the co-pay requirements, including the co-pay requirements that apply across the board to individuals who access care in the emergency room for non-emergent conditions. The swipe or debit card capability or technology that allows individuals real-time cost transparency into the cost of the health care services that they are receiving, and also allows them the ability to determine what the impact of the cost of those services are to their Power accounts and how much funds they have left available to fund their future healthcare needs down the road. And then, of course, the rollover credit feature that allows individuals to get credit against future member contributions by simply engaging in preventive care visits and other health and wellness type activities. There is no doubt in my mind that the HIP 2.0 program has been game-changing and innovative in how we think about and how we approach the delivery of meaningful healthcare coverage to individuals that need it the most. And in just 1 year, has delivered very compelling results that have made a positive difference in the lives of tens of thousands, actually hundreds of thousands of Hoosiers across the state, and has driven outcomes that, frankly speaking, have even exceeded my own expectations. We at Anthem have had the privilege of being part of the Healthy Indiana Plan, going back to the original HIP 1.0 program since its inception in 2008. And we've also had the privilege and the opportunity to work with Governor Pence, Secretary Werner, Medicaid Director Joe Moser, and others in the implementation of the HIP 2.0 program here in Indiana. We currently serve about 145,000 members within the program at Anthem. And on the heels of the original HIP 1.0 program, we always had the confidence and the belief that with the payment innovations, the capabilities, and the enhancements that were built into the current program, that our members would not only get more engaged with their healthcare decision-making and healthcare choices, but would also be satisfied with the results and the outcomes of those choices. Our data, or our experience, for example, has shown that in just a year, for those individuals who transitioned from the traditional Medicaid program, the Hoosier HealthWise program, into the HIP 2.0 program, that they experienced a 40% reduction in emergency room utilization during that period. Doesn't stop there. When we took a look at our consumer satisfaction survey results that were recently concluded, about 90% of individuals indicated that they were satisfied with their health care coverage and also with their overall health care. Doesn't stop there. As Governor Pence mentioned, 70% of individuals are making contributions into the Power account. They're actually taking the responsibility to make those contributions. and a fair amount of them are making the contributions upfront for the entire period. It gets better. Over 80% of those individuals have incomes that are less than 100% of the federal poverty level. Doesn't stop there. 60% of those individuals are at income levels that are less than 23% of the federal poverty level. So, does it work? The results speak for itself. I'm going to conclude with a prediction, and it goes this way, that someday in the future, when our children, grandchildren, and great-grandchildren are reading the history books on the evolution of the healthcare delivery system here in the United States, that prominent mention will be made of Governor Pence and the administration with regards to starting the revolution in how we think about and how we approach the delivery of meaningful coverage to those individuals that need it the most in order to drive the outcomes that we all desire. So clearly, individuals are getting more engaged in their healthcare decision-making. They're more satisfied with the outcomes of those decisions, and they are taking responsibility in the choices they make. Finally, there will also be a footnote to Secretary Werner, Medicaid Director Joe Moser, Michael Gargano, Seema Verma, and all the others that took the bold steps or actions in order to make this happen. So again, congratulations, and thank you for the opportunity to be here today in celebration of the one-year anniversary of the HIP 2.0 program. So at this point, I'd like to turn it over and invite a colleague of mine, Dr. Stanley, to the podium. And Dr. Stanley is the director, regional director actually, for St. Vincent Medical Group.
So I was asked a couple of weeks ago to participate in this, and I was very excited to do so. For those of you that know me, I'm often hesitant to get excited about something new coming down the pipeline. As a family doctor, I've seen a lot of new things come and go because they don't work. So I was a little bit hesitant about this. I've been a family doctor in Jennings County since 2001. Part of what I love about practicing in a small town is that's where I live. Those are the people that teach my kids at school. Those are the people that make my coffee before I go to work in the morning. That's the place where I buy my side of beef. And those are the people I want to take care of. I've had so many patients who come to me on Saturday morning, hey, what do you think I ought to do about this? Or they'll send me a text. And truly, it's been a barrier for them to get into the office because they don't have health insurance. And HIP 2.0 has given them an opportunity to get in and see the doctor in the manner that they should be seen and taken care of. It's okay to give medical advice standing in the grocery store, but it's much better to have my patient in a room where I can really, rather than my kids hanging on me and trying to figure out where the milk is. And so it works. HIP 2.0 works. Thanks. And on a selfish note, it's given me the tools to take care of them. I think about a fellow named John. I take care of John, his wife, his 3 grown kids. I've delivered 3 of his grandbabies. And John is a farmer, and he's got diabetes. And he would laugh at me when I would talk to him about how important it was to control his diabetes. And he said, if it's not on the $4 list at Walmart, I can't get it, Doc. I can't. And I'm like, look, we got to get this under control. You're going to have a heart attack. He's like, no, and I'm not going to have a stress test because I bale hay. I don't need a stress test. I'm like, you need a stress test. This is what's going to happen to you. And so as we go through all this, he's strapped, and he truly couldn't do anything off that $4 list. And samples in the office only go so far. Eventually, John got HIP 2.0. John was in the office the other day, and for those of you who know what an A1C is, his A1C was 7. And he's good, and now his wife knows when John's not doing well, she calls and she gets him in, and he's in right away, and he's not afraid to come in anymore because now he has a copay as opposed to the entire office visit. And now he knows when I give him a script, he can go to the pharmacy and get his prescription and get better. And he's engaged in his health care. And that too, I have to say, taking care of my HIP 2.0 patients is so enjoyable. They're engaged when they come in to see me. They're interested in what I have to say. They take it seriously, and they want to be a part of their health care. They're interested in being healthy. As a family doctor, that's what I want, of course, for my entire community. So, thanks for the tools, and thanks for my health care and my community. I got lots of stories. So I'd like to introduce one of my colleagues. Shelley Sparks is a nurse practitioner up in Anderson, and she takes care of, I think, the same community I do, just on the other side of Interstate 70.
It's true. Well, I too am very excited about HIP 2.0. I'm a nurse practitioner. I've been in practice since 2001. I am adult and geriatric. And I'm very, very embedded in my community in Anderson, Indiana, Madison County, Indiana. And I can tell you there's always been a huge disparity in healthcare there. And since HIP 2.0, I have been so excited to watch how it's worked. And I've heard people say, over and over how, our patients that are on the government programs are not engaged and don't want anything but a handout, And from my perspective, I am seeing patients that are opposite of that. They're coming in, and with HIP 2.0, we are seeing so much better care. And I was prepared for some numbers, and I changed that because you've already heard the numbers. It's impressive. But I can tell you on my end of it, research shows that if we look at prevention and wellness, which is what I like to look at in healthcare, and prevention and wellness will bring about not only better quality of life and quantity of life, but it also reduces cost over time in our healthcare system. And so what I look at and what I am so excited about is watching these clients come in. These members come in, and they are now getting their blood pressure screened. We know that it causes, the high blood pressures that go for long periods of time cause other chronic medical problems, heart attack, stroke, renal problems, and failure. We are watching as our diabetics now are able to get their numbers. We're catching diabetes early. We're able to educate and train them and teach them how to manage their disease better, make lifestyle choices that can correct these problems and get away from the chronic medical problems in the end. We are watching as we've gotten people in, women that haven't been seen for 10 and 20 years who are now getting mammograms and pap smears. We have people who are getting colon cancer screening. And those things are very important because we can catch disease early before it gets too costly. We are stopping a lot of the ER visits and a lot of the visits to the hospital admits that are very expensive because in my world I've been in a unique position. I am working both with St. Vincent and with Open Door Health Services, and we've almost created a kind of a safety net almost because they're coming through the hospital and they're admitted in, and then social work picks it up and helps get them connected to Open Door, where our navigators can actually help to get them connected with HIP and start their care. And so we're seeing those people come in and reducing the visits. I'm also seeing diabetics who have not been able to have an eye exam. They may have been diabetic and for years, but never, ever had an eye exam. And so, since HIP 2.0 is here, they have been able to get that done, which is very impressive. And then along the lines of behavioral health, we've had so many go through behavioral health and counseling that way. I have addicts that are on Vivitrol injections and connected with behavioral health that are clean from their heroin. So those are all, in a sense, going to have an impact on our community in the future. So what I see is that HIP 2.0 has not only been a huge benefit and blessing to our members of the HIP program, but they're a benefit and a blessing to our community as well. So I just want to say thank you to you as well, because I am so excited with what we were able to do, and I look forward to the future and what this is going to prove.
Thanks, Doc. Thanks, Shelley. Appreciate it. In 1881, when 4 Daughters of Charity arrived in Indianapolis to begin healthcare, which is now known as St. Vincent, a statewide healthcare network, they made a comment that resonates so deeply with me. We're here to keep healthcare human. Human for the provider, human for the patient, human for the caregiver. The rich will come and the poor will come if they see that we treat people as humans. And I can't help but continue to go back to what our governor has done with HIP 2.0, because we now have greater tools, and you've heard stories today about how healthcare is more human now because of HIP 2.0. On behalf of St. Vincent, we appreciate you coming out to mark this incredible one-year anniversary. I see members of the media there. If you've got questions for anybody on stage, feel free to come to the front, but otherwise, have a wonderful afternoon, and thank you again.